All right, what's going on, guys? Ski Bass Medic here. So today we're gonna go over head injuries just really quick and what to do if your patient has a helmet on and the things that we're looking for. So come on, bring it on in. Right, so right here his helmet's unbuckled because he wants to be like John Wayne. But if it were buckled, of course, just unbuckle it real quick, it's not a big deal. What I can do then is I can reach back here, right? Pop his ear pro. Okay, with my non-dominant hand, I can get back there and I can support his head and I can use my body leverage upwards, well, going back to hold up his head. So my body leverage is doing all the work. And with my dominant hand, I can gently remove the helmet. If I have padding inside, I can remove the padding and tuck it underneath his head. So, there you go. Just to make it a little bit more comfortable for him. If the padding was, impossible to remove or some shit like that, don't worry about it. You can use a t-shirt or something else to prop up the head. Now that we look at the head, what I'm going to do is I'm going to look for deformities. I'm going to look for any punctures, any bleeding, any apparent trauma to the face and to the rest of the scalp as well. So I'm going to palpate, all right? And when I'm palpating, what I'm feeling for is I'm feeling for tension. So if it's very rigid, I'm feeling for instability, and I'm feeling for crepitation, right? And crepitation is when the bone is broken and it has like a gravelly feel to it. So I'm palpating the skull, I'm palpating the zygomatic bones, I'm palpating his maxilla and his jaw and the rest of his skull. And I can feel his neck for any step off. Step off is when in the spinal column, one of the discs has slipped out of place and you'll feel it. You'll feel kind of like a little bump, right? So I'm looking at his skin color, noting his skin color, if it's pale or if it's clammy or if he's very sweaty. I'm also looking underneath the eyes, looking if there's battle signs.
What's going on, guys? Ski Mask Medic here. So as I'm editing this video at like fucking 3 in the morning, I realized I made a mistake in the video. When I was pointing at his eyes, I said that they were battle signs. What I meant to say was that they are raccoon eyes. So raccoon eyes are when there's bruising beneath the eyes, almost where there's like bags under the eyes, and you'll see that kind of bruising discoloration there. Battle signs is when there's that bruising behind the ear, and both indicate a skull fracture. It'll present in different ways. So there you go.
You'll see bruising and that kind of things, and that'll tell me that there's a fracture within the skull. I can also get behind his ears and I can check. I know I'm moving his head a little bit just for training purposes. So along here, it'll look like bruising. And what that means is those are called battle signs. And that means that there's a fracture at the base of the skull. Very bad news bears. So I'm gonna check both sides, okay? And I'm going to pop his maxilla. I'm going to, if I can, open the jaw, right? I'm gonna see if his airway is clear. That's if he's unconscious. If he is conscious, just be like, hey buddy, how you doing?
I'm doing good, how are you?
He's talking to me, he's awake, he's aware. Questions I can ask him if I suspect an altered mental status. Hey buddy, how many quarters are in $1?
4.
4? So he's using deduction, he's using reasoning and logic to draw that conclusion. What's today's date?
April 7th.
What day of the week is it?
It's Sunday.
What color are my balls?
I don't know, man.
All right then. So that's how you go ahead and assess where his level of consciousness is. As for actual injuries and treating them, so let's say I find a deformity, a depression in the skull, right? So if there's bleeding coming from it, from that deformity, from that laceration or whatever, I'm not exactly gonna press down on it because there's some very important shit inside the skull and I don't wanna fuck that up. So what I can do is I can grab my handy dandy pre-prepped donut, gauze donut. This one's a little fucked up because we've been using it for training all day. But what I can do then with this is I can use it to apply pressure around the injury, right? And then I can go ahead and wrap it. I can go and wrap it up. If the injury itself is closer to his face, closer to his eyes or closer to his ears, I want to avoid wrapping his eyes and his ears because he needs that in a tactical environment to go ahead and react to his environment, right? The environment's continuously changing. He needs to react to it appropriately so he doesn't die and so we don't die.